one of the ways I think that healthcare and healthcare improvers have talked about becoming even more sophisticated in this space and maybe more inclusive is to talk about co-design, co-production, really getting patients and families involved in the redesign of care. We didn't talk about that much on today's show, if at all. We really talked about that more vulnerable patient experience and what can often feel for patients and families like entering a pretty scary foreign land, and what people are looking for as wayfinders and reassurance and helpful information. What about this nitty-gritty co-design and co-production? Is that the right focus, or does it take us too much away from some other things we haven't even gotten right yet?
No, I think the co-design is absolutely essential. I think it's probably the only path toward solving some of these problems, because just in the radio program I shared, being part of a team that was trying to affect a certain piece of the patient experience, and it was only on reflection of my own experience as a patient at that institution, and suddenly I thought, this wouldn't have reached me because my set of circumstances was slightly different. And without that perspective, so I raised that and I said, it's really interesting. We've probably covered this experience for 75% of the patients, but for me personally, it never would have reached me. And how many more people are like me? And we looked into it, and it was about 25% of the patients were going to have my experience, which wouldn't have included the process that we'd been working on. So without that element of co-design, of really thinking through the experience of the patient, you're missing things. And I think that's also a perfect example of we're trying to design processes. If we do it in cooperation with patients, then it's a more perfect world. We reach everybody. We have the essential missing link, that perspective.